Are you someone that's getting up 2, 3, 4 times a night to urinate? Are you frustrated about it? What's causing it? Is it normal? Well, I'm a urologist and pelvic surgeon, and today we're going to talk about frequent urination at night and what might be causing it, and if it is something simple like an enlarged prostate. So, how many times a night is normal to urinate? Well, generally speaking, at night we usually wake up one time to urinate. Most people will get up one time, urinate, maybe 150 to 200 mLs or 5 to 6 ounces of urine, and go back to sleep without any problems. If you're getting up more than 1 or 2 times a night, it's considered abnormal, and we need to investigate further as to why that might be happening. One of the most common causes, especially in men over the age of 50, is an enlarged prostate. So, what exactly is an enlarged prostate? Well, the prostate is a walnut-shaped gland that sits underneath the bladder, around the P-tube, or the urethra, and its function is to make seminal fluid. And so as men age, what we see is that the prostate can enlarge, and when it enlarges, it can start to push on the P-tube, or the urethra, and the bladder neck where it kind of narrows down to leave the bladder. And that narrowing can then cause symptoms like when you're trying to urinate, you have a weak stream, you have a start-stop stream, you dribble after you urinate. You might also find that you're emptying your bladder completely. But because the prostate is enlarged, you might feel like you still have urine left over, and this is all because the prostate is pushing on that P-tube and not allowing the urine to empty normally. So how do we diagnose an enlarged prostate? Well, the easiest way is through a digital rectal examination. I have lots of videos on what to expect with a digital rectal examination and what it's used for. If you want to learn more about that, check those out. Other ways we can diagnose an enlarged prostate is with a bladder scan. A bladder scan is where we look at the amount of urine left in the bladder after you urinate just to make sure you're completely emptying. And if there's any left over, we know that it might be due to an enlarged prostate. Also, sometimes we'll do a urine flow chart. A urine flow chart is where you'll come into the office and we'll have you urinate into a device that actually charts the speed and the volume of your urine stream. The next question is, well, if I have an enlarged prostate, what can I do about it? Well, there are multiple options available. If you want to learn more about them, check out my video on treatments for enlarged prostate. Other causes of getting up at night to urinate include having a urinary tract infection. You may also have trouble emptying your bladder completely because of a condition called overactive bladder. Overactive bladder is a condition where your bladder is squeezing when it shouldn't be, making you think you have to go to the bathroom, even if your bladder isn't really full. So if you're getting up at night to urinate frequently, make sure you go see your primary care doctor or urologist to get checked out. Make sure there's no underlying medical conditions that might be causing it, and if you're a man over the age of 50, it very well could be an enlarged prostate. So don't be embarrassed, go get checked out. It's very, very common, and there's lots of treatment options available. If you enjoyed this content, please share it with your friends and subscribe down below. As always, remember to take care of yourself because you're worth it.